Hello, everybody. Welcome. Thank you for joining us tonight for the first Wayne County Air Quality Information Session. My name is Katerina Stylianou, and I'm the Chief Epidemiologist and Data Officer for the Wayne County Department of Health, Human and Veteran Services. We are here tonight to discuss air quality. As you may know, Wayne County has some of the worst air quality in the country, and this is a well-known public health issue that our communities suffer from. In response, earlier this month, Wayne County, in collaboration with JustAir and community leaders, launched a comprehensive network of 100 air quality monitors throughout our 43 communities to increase air quality transparency and take action to keep our air clean and our communities healthy. What we are trying to achieve with this project is to address air quality concerns and collect data that will provide a more detailed picture of the country's pollution hotspots, alert residents when pollution levels are high to protect themselves, guide policy decisions, and also hold the biggest polluters in our community accountable. We have put together a great group of panelists for you tonight, and we will review the following topics. Next slide, please. So we will first discuss the state of Wayne County's air quality, learn more about the basics of air quality measurements, and then introduce the JustAir dashboard. Some housekeeping before we start. Please remember to mute your mics. Tonight, the info session is a webinar style and it's being recorded. So if you have any questions throughout the session, please put them in the chat for the Q&A session at the end. Okay, let's get started. Without further ado, it is my great pleasure to introduce our first speaker for tonight, Lukas Ayers. Lukas is an epidemiologist with Wayne County, and he will give us an overview of the current air quality trends and related health impacts in our county.
Good evening, everyone. Thank you for joining us tonight and for your interest in air quality. And thank you, Katerina, for that introduction. A little bit of what I'll be going over today. I'm going to start with some key takeaways from this presentation, discuss air pollution in general and how it moves, the health impacts of air pollution. Then I'll move on to the American Lung Association's recent State of the Air report for Wayne County. I'll discuss asthma and COPD prevalence rates in Wayne County, discuss how to stay safe from air pollution, and then a little bit of discussion on wildfires at the end. So first, I want to start with the impact or key takeaways from this presentation. Air is essential to life. It impacts every single one of us, all of us that live, work, learn, and play in Wayne County. Air quality, both indoor and outdoor, can have impacts on our health. And really, if you have lungs and you're alive, you're going to be susceptible to poor health outcomes associated with poor air quality. And of course, communities of color face disparities and inequities in both exposure to poor air quality, but also in facing barriers in addition to access to affordable health care. And significant progress has been made in Wayne County at the state level and nationwide in reducing air pollution since the late 1990s and early 2000s. So it's important to recognize that progress, but also understand and recognize that there are vast opportunities for improvement. So first, I want to start with this great infographic from the U.S. National Park Service. And this is basically showing where air pollution comes from, whether that be natural sources, like volcanoes and wildfires, stationary sources, that could be like a factory type setting, mobile sources like airplanes, transportation methods. The point here is that air pollution does not come from any one distinct source or entity, but rather a multitude of sources, both natural and human-made. The three main contributors in our area in Wayne County are going to be transportation, industrial activity, and construction. In addition to these sources, we also have been experiencing changes in climate in terms of excessive heat, as well as wildfires, typically occurring in Canada, that have been impacting our air quality. And why do we care about wildfires in Canada when we don't really have that much forest coverage in Wayne County? If you go to the next slide, another great infographic from the National Park Service, and this describes how air pollution actually moves. Air is not stagnant or static, and neither is air pollution. It travels, and so what's happening in a neighboring jurisdiction or even a neighboring country can impact us. Next slide. So what does air pollution actually look like? You'll see the phrase PM 2.5 or PM10 mentioned. And what exactly does that stand for? The PM stands for particulate matter, which are tiny particles in the air, and the 2.5 references micrometers. So PM 2.5 is particulate matter that is 2.5 micrometers or less in diameter. And I think this is a great example to show that PM 2.5, these particles are about 30 times smaller than a strand of human hair. So due to their size, they can travel deep into our lungs, entering our bloodstream and causing a number of various conditions. So the U.S. Environmental Protection Agency, or the EPA, has identified 6 criteria air pollutants that they set regulation standards for via the Clean Air Act. And those 6 criteria pollutants are labeled on this slide. In addition to these 6 criteria pollutants, there's over 180 other pollutants that have been identified as hazardous and identified as being known to or suspected to cause cancer or other serious health effects. As I mentioned earlier, if you have lungs and are alive, air is essential for life. And the quality of that air is essential as well, both indoors and outdoors. And poor or negative air quality can have impacts on our health, both short-term and long-term. Some of those short-term and long-term health impacts are listed here in this infographic, which can include, acutely headache, inflammation of the eyes, nose and throat, coughing, painful breathing, pneumonia, bronchitis, or skin irritation. And some of those longer term effects can be impacts to the central nervous system, cardiovascular diseases, respiratory diseases, impacts on our liver, spleen, and blood, and impacts on our reproductive systems. And there are some populations that are going to be more affected or more impacted. And those are listed on this infographic as well. And that includes individuals that are living with any chronic respiratory diseases like asthma, COPD, or lung cancer, seniors or those who are 65 years or older, children less than 18 years of age, pregnant women, and people who often exercise outdoors. Next slide, please. So getting into the American Lung Association's recent State of the Air report, Wayne County was graded an overall F rating for air quality and for ozone and particulate pollution. And the State of the Air report grades exposure to unhealthy levels of ground level ozone air pollution, annual particle pollution, and short-term spikes in that particle pollution over a 3-year period. So this year's most recent report includes air quality data from 2020 through 2022. So starting with ground level ozone pollution in the Detroit metro area, our metro area ranked 33rd worst in the nation for ozone pollution. So this ranking is based on the area's worst county's average number of unhealthy days, which was 5.7 days per year in Macomb County. This was better than the area's ranking in last year's report card of 32nd worst. For particle pollution, we ranked 35th worst in the nation for short-term particle pollution. This ranking, again, is based on the area's worst county's average number of unhealthy days, which was 5.8 days per year, and that was in Wayne County. And this was the same as the area's ranking in last year's report. For year-round average level of particle pollution, Wayne County was again the area's worst county, receiving an F grade for pollution levels above the federal standard that was recently updated by the U.S. Environmental Protection Agency, or EPA. So overall, the Detroit, Warren, Ann Arbor, Michigan metro area ranked 13th worst in the nation. which is one spot better than we ranked in last year's report, which was 12. We move to the next slide. This is going to show our trend in Wayne County since 1996 for that high ozone or smog pollution. And as you'll see, significant progress has been made with 23 fewer days overall for 2024. And then in the right-hand side of this graph, you'll see the Southeast Michigan call out and with those graded levels. So Wayne County is rated at an F and Macomb County is as well. Next slide. And so this slide again, the left-hand trend chart is going to show that particle or soot pollution, a daily average. And again, significant progress has been made since the year 2000 with 18.5 fewer days this year, but we are seeing a steady increase since 2018. And then on the right-hand side of this slide, you have the Southeast Michigan neighboring jurisdictions as well. Next slide. And this slide is showing that annual particle or soot pollution for Wayne County since the year 2000. Again, we note that progress has been made, but it has remained stagnant or flat for the past several years. And then on the right-hand side, again, you have the Southeast Michigan neighboring jurisdictions as well. And you'll note that Wayne County is the only jurisdiction in Southeast Michigan with a fail. The annual particle pollution. This slide is again looking at annual particle matter solution in Wayne County. This is coming from County Health Rankings data, which is produced by the University of Wisconsin. And this just again shows that significant progress has been made in Wayne County. However, you see again, since 2018, we are seeing increases for this metric. And Wayne County does remain well above the averages for both the state of Michigan and the United States. Next slide. So these are specific Wayne County populations that are considered at risk or higher risk for exposure to air pollution. And this is also coming from the American Lung Association State of the Air report. So I first want to highlight that persons and communities of color account for over half of our total population in Wayne County at 51%. Children under the years of 8 to 18 years of age account for nearly a quarter at 23%. Persons living in poverty or experiencing poverty at 21%. And then those senior adults, 65 years and plus, at 17%. So this next slide is from CDC Places data, and this is looking at current prevalence rates for asthma and COPD in Wayne County. And the darker the gradient on these heat maps, the higher the prevalence percentage for that census tract. And what I want to highlight here is you'll notice that for both asthma and COPD, you're seeing higher prevalence percentages within the city of Detroit, as well as in the Southwest and downriver communities. You'll also see higher prevalence percentages in the city of Inkster, as well as in the areas around Metro Airport. So this slide is looking at current asthma statistics in Wayne County. 13% of adults have reported having asthma or ever being diagnosed with asthma. 9.3% of children less than 18 years of age reported having asthma. The Wayne County asthma mortality rate is 15.1 per 1 million people, and this is about 1.6 times higher than the Michigan rate. And then annually, we've reported about 2,000 hospitalizations related or attributed to asthma each year. And tuning with hospitalization data for asthma in Wayne County, we want to note some disparities by race for Wayne County, specifically the hospitalization rate in Black Wayne County residents versus white Wayne County residents. You see it's about 5 times higher in Black Wayne County residents compared to white residents. And then overall, the hospitalization rate in Wayne County is about 2 times higher compared to the state of Michigan. So those are significant disparities. Moving on, this slide is going to talk generally about the air quality index that's provided by Air Now, and can be found on the Air Now website as well as our Wayne County landing page as well. So this is a color-coded way for the public to see what levels some types of air pollution are in their area. So the higher that AQI value, that indicates that there's a higher concentration of pollutants in the air and a need to take steps to protect our health. And Air Now has some great resources for understanding that AQI guidance. And on the right-hand side of this slide, we have outdoor activity guidance. This is more geared towards schools and younger populations and those that are heavily involved in the outdoors. But this is a helpful color-coded flag system that specifies, action steps that can be taken based on that corresponding AQI level. So looking at some tips for protecting ourselves on bad air quality days, most importantly, reduce the time that you're exposed to that air outside, reducing the time that you're active outdoors, considering less intense activities that require less physical exertion, especially outdoors. If ozone levels are unhealthy, try to schedule any outdoor activities for the morning or evening hours when those ozone levels are typically lower. In the event of wildfire smoke, which we'll go into a little bit later, avoid activity to create more fine particles than are already, occurring from that wildfire smoke. Including smoking cigarettes, using gas, propane or wood burning stoves and furnaces, burning candles or incense. That all is also creating additional soot or particle pollution. Also, in the event of wildfire smoke, you can create what would be called a clean air room. If you can't stay cool at home, or the electricity goes out, or there's too much smoke, it's still getting into your home, it may be best to seek shelter elsewhere. And you can always call 211 for information on local cooling centers. So wildfires. Again, why do we care in Michigan? This is something that hit us kind of hard and heavy last summer, something that not many of us were familiar with. But especially Southeast Michigan, we got hit quite hard last summer and experienced unique levels of poor air quality due to smoke from the neighboring Canadian wildfires in Ontario. And the 2024 wildfire season has already started and is picking up in Ontario. And we just had, AQI alerts last weekend in Southeast Michigan due to wildfire smoke from Canada. So these are some steps and signs to look for, and especially individuals with chronic health conditions, chronic respiratory conditions, people who are pregnant or over 65 and young children. Signs to look for the wildfire smoke is going to be that sore throat, irritation in the eyes, nose, coughing up phlegm, headaches, and wheezy breathing. Severe signs are going to be shortness of breath, severe cough, feelings of dizziness, fast heartbeat or chest pains. And you're going to want to contact a healthcare provider or medical personnel immediately for any of those more severe signs. And then it's important for, if we are experiencing wildfire smoke, staying hydrated, checking in, especially on senior neighbors or those with young children. Again, relocating if there's too much smoke getting into your home still. Local libraries, community centers, calling 211 for local cooling centers, reducing exposure outdoors. And then there are some filter recommendations that can be made for in the house as well.
Thank you, Lucas. Thank you for providing all the different ways we can stay safe on bad air quality days. If you have any questions for Lukas, please remember to put them in the chat. For our next section, I'm really excited to introduce our partners in crime for this project, the JustAir team, who will discuss how air quality is measured, share insights on the Wayne County Air Quality Monitors Network, and showcase the JustAir dashboard. Darren Riley is the founder and CEO of JustAir, and Kristy Allen is a project manager for JustAir.
Awesome. Thank you so much. I appreciate everybody for joining, and also huge thanks to the County of Wayne, where I reside, our business resides. This really shows the effort and the thoughtfulness to create this initiative to combat the things that are hard to hear, right? So also thank you, Lukas. The wealth of information is super helpful, for our communities to understand this information and deal with the things that are challenges, right? We kind of have to face them head on to really navigate this world. My name is Darren Riley. I'm the founder and CEO of JustAir. JustAir was founded out of my own personal experience of dealing with air quality. I lived in Southwest Detroit, developing asthma 6 years ago. And upon developing asthma, upon moving to Southwest Detroit, just opened my eyes to all the disparities that hit home, especially during COVID, right? So through, personally dealing with the illness and also seeing how our communities get hit the hardest, especially with all the health disparities, with diseases like COVID and other things, forest fires, and how our communities get impacted, we really had to come up with a response. And so what JustAir really is a technology platform really focused on air quality insights to ensure that we have access to the information to really navigate the world that is happening to us. And so really our goal and mission is to protect the average breaths we take, around 20,000 average breaths per day per person, and ensure that we're thinking about each and every one of those breaths as we navigate our world, and ensure that those are healthy ones that we're entering into our body. How do we do this? We'll get into some of our tools, but mainly for the efforts here is really through partnership, through community action, through community awareness, to really help drive local change. So we'll get a little bit to that, little bit into that later. But overall, before we move on, just want to level set the work that we are intending to do here within Wayne County. The technology that we're deploying in the community is really for us, by us, to really move the needle. So really thankful for the community joining this call, and all the leaders throughout the county who've been facing these problems that we've all endured, to really have some innovation to move the needle and move that F to a higher grade. We can't bring that report card home. So we'll make sure we're moving that direction. So excited for that. I'll kick it over to my colleague, Kristy, who's been leading this project, to give us more information on AQI, and then we'll go from there. But appreciate it. Kristy, I'll kick it to you.
Awesome. Thanks, Darren. Hi, everyone. I'm Kristy Allen, project manager on the JustAir team. We're going to review some of the AQI information that Lukas already introduced. So AQI, again, stands for Air Quality Index. Air is where monitors were installed across the county. To select locations for monitors, we worked with community leaders, public health data around asthma rates, lung and heart disease, population density, and many other criteria. The 100 monitors are largely measuring particulate matter and NO2, and in hotspots across the county, additional parameters are also being monitored. So that's NO, CO, ozone, and SO2 as well. So in small amounts, these pollutants are not terribly hazardous for humans. However, when concentrated heavily and in residential areas, schools, community centers, or areas with little green space, these pollutants are known to cause spikes in AQI, making the air unhealthy to breathe. So the various colors you see on this map are associated with the live AQI at that monitor's location. So you can see that AQI varies significantly from community to community, hour by hour. So our goal at JustAir is to equip residents with this information so that on an individual level, you can use this information to inform decisions about your daily life. So I'm going to pass it back over to Darren, who's going to tell us a little bit more about what the JustAir dashboard looks like.
Cool. Thank you, Kristy. So yeah, overall, the major innovation and really the tool that we change the pen here. There we go. The major tool that we really deployed for Wayne County is My JustAir, which is accessible to throughout all the communities that have our networks. And the ability for us to really give the transparency that we need, but also accurate and relevant data, right? So people who are familiar with, air quality dashboards, you kind of often get alerts from a more regional area. And now that you saw the map before, we have multiple monitors. So there's a greater chance that that monitor closer to you is more relevant to you, right? So if you live way on the east side of Detroit, and you're looking at a reference monitor that's way on the west side, we can really fill in those gaps by having, lower a different network of sensors that are close by in proximity. To have relevant information. And also, I want to know before I dive in to the next slide, Kristy, is that, why 100 monitors and why this level of density? What this now gives us the capability to do over time is to really triangulate and look at hotspots where we have a regional look at the air quality. Now we can dig a little bit deeper under the hood and see where different neighborhoods are disproportionately affected, probably correlated with the health data, but then be able to pull levers of intervention. But that's down the road. Right now, we're going to focus on really what tools you have at your fingertips to help you navigate the world and your families and loved ones. We go to the next slide. So introducing the My JustAir app. This isn't an app in the App Store, but it is something that it's a web app that you can go onto right now and access through the QR code. We'll have it on this slide and the other slide, so feel free to just take out your phones. If you're on your phone, we'll also send this link out to residents as well, and also give instructions on how to navigate the platform. There's some really cool built-in widgets to help you navigate as well. The real key objectives of this application is, one, follow the monitors that are relevant to you. So your place of worship, where your kids play, where your grandparents live, where do you go to work, where are you spending the most time. So to get access to those monitors, you can favorite them, receive relevant alerts when air quality is bad, but also when things are good. And then also share these alerts with your community and loved ones to make sure everyone's protecting themselves in the event of issues. So as I said before, as the world is happening to us, equipping us with tools to help navigate our world. So the more information, we're more equipped to hopefully avoid some of the health risks and burdens in our community. We go to the next slide. So here, we'll just do a quick preview. Again, there'll be a lot of opportunities, and our team is totally accessible. We'll give our information out to do deeper dives with communities. But what you see here on the right is a video on navigating the dashboard. So once you log on and sign up with your phone number, a couple features, core features of the app that we have right now are, first, browsing monitors. So looking at the monitors on your dashboard, you can turn on your location setting to zoom in to the monitor near you. As you see here on the widget, you're favoriting a monitor by clicking on that heart. That heart signifies that monitor to be in your My Monitors. That's the next bullet point. So now you have a list of, while we have 100 monitors, that can be overwhelming, but now you have 5 or 7. If you want all 100, you can do that. But making sure that you can focus on the neighborhoods and the areas that are relevant to you, right? And there are times that we've even seen in the dashboard where certain areas of our community will be at high AQI and others may not have such severe issues. So those are really good, tangible opportunities to really make sure we have relevant information as we navigate our neighborhoods and our communities and through our diverse community. When things are bad, you will receive a text message alert with some feedback, and we're improving this, and we will love feedback to make sure we have relevant information so that you can navigate the pollutants that are causing that issue. So while we call it air quality index is an expression of the worst pollutant that is concentrated in your area. So that could be ozone. If it's a bad ozone day, maybe it's a day to carpool. Maybe we can be more proactive and cut our grass with gas-powered mowers. Sorry, that was horrible. With gas-powered motors the day before. So just really limiting our activity to not really add to some of the issues that are happening in our community. If it's particulate, maybe the forest fires, it's maybe time to whip out the N95 mask and really make sure we control, what enters our bloodstream through our breathing, same way we did with COVID. So we'll have some of those curated alerts as we develop the platform. You also can download the data. We're improving this as we go. Right now, you can download the chart, but we will also add in other downloads from Excel sheet with a parameter around the time. So work with us. We'll have different features around the downloading settings. So you can look at the data, look at the patterns that you're seeing. It can be helpful for your neighborhood to really navigate and see what's going on in our community. Like, hey, the monitor next to my kid's school is spiking with NO2 every day at 3 p.m. Oh, that might be, us idling, or the bus is idling. Maybe it can enact some intervention at the school to ensure that we're keeping our children safe. So little things like that and tactics we'll be exploring down the road. Last but not least is air quality FAQs. Our team is open for reaching out to us and navigating the portal and getting feedback. And everything that you see here built was asked for community, so we will welcome that. We are a local startup, so please be patient as to address that. But these FAQs will be helpful to navigate different questions like, hey, how did we select monitors? What does AQI mean? That we can share those resources, or what are the different sources of the pollutants, right? So these FAQs are at your fingertips to really navigate and educate yourself and your family members with the application as well. So again, you have the QR code here. Feel free to sign up, subscribe to monitors near you. They have some tutorials, and we also will be sending this over to make sure everyone has access to it if you're calling in from your phone. I think I can kick it back to you, Kristy. Thank you.
Awesome.
It's
So
on me. Okay.
I think it is, but you're good. These are kind of similar to some of the recommendations that Lukas made previously. So tools to stay safe when you receive some of these air quality alerts. So primarily we love to support education, right? So inviting people that maybe don't know a ton about AQI to sessions like this, and we'll work to make sure you all have education tools to share with friends and family. Sign up for the AQI alert. Sometimes it's hard to remember to check that, right? So if you have an alert that doesn't require you to go, check an application yourself, then that kind of removes one of the barriers. Wearing masks, in-home filters, these are things that Lukas previously touched on. Some larger community care opportunities are tree planting. If you've are in the city of Detroit, I want to shout out the Greening of Detroit. They do amazing tree plantings. Understanding air quality policies in your city and state, and then advocacy. So understanding what change you want to see in the world and how can the JustAir data kind of support some of the work you're trying to do out there. We'd love to hear from you. And then Darren, if you want to touch on some of the types of change we see in the work that we do, that'd be great.
Yeah, absolutely. I think we look at JustAir, we look at 3 pillars of change with our data, and we've seen not only here in different states throughout the US, but also in other countries. So one thing I want to leave us with, there's a lot of information on the disparities, the issues, the burden that we bear as a community here in Wayne. The positives is that it is possible. It is possible to alleviate this burden and alleviate the health issues that are hitting our community with more information, with partners like Wayne County, but also with a strong, resilient community like we have here in Wayne County to really activate and move the needle some of these issues. So I'll start on the left from behavioral change. We kind of alluded to when things are happening, the more we know, the better we are reacting. A funny joke is like, make sure when you're in your places and communities, share this information out. They call me Mr. AQI at my barbershop now. It's really a bad nickname, but when the air pollution, was going on in the forest fires, having this data at your fingertips and understanding what to do with it in those settings where our community members are. So not everybody here is the only ones with this information. So make sure your places of worship, your parent-teacher meetings, within your household, at your cookouts, the family cookouts are about to pop off at Belle Isle. make sure we're educating folks on the things that we can do in our fingertips so we can spread the word, spread the awareness, and keep our good people safe. Next is environmental intervention. So shout out to some of our partners throughout the state. For example, in Dearborn, looking at creating a green barrier between industry and residents to actually mitigate issues. We've seen other initiatives around tree canopy, removing the heat locally to help mitigate ozone creation and formation, ground level ozone. So there are things we can do with electrification of school buses, right, to prevent idling school buses or diesel buses, or get into a more friendlier energy source for some of our diesel trucking and also transportation. So there's things we can do at our fingertips to help alleviate the burden that is happening to us, right? And then lastly, structural, right? What are the long-term policy changes, initiatives? I have to give a shout out to our good folks here in Wayne County and throughout the state. Clear the Air is a great initiative that I would, urge people to get more information on, policies that residents are looking to join and understand more on what things could be made. But JustAir's whole purpose is really to do the research, look out beyond the state, beyond the U.S., throughout the world, and find best practices that actually fit the context of the things that is possible here for our residents, so we can move our grade up from the F that we currently have. So I was going to leave you all with that, is that we will be making changes, and we have the community and the partners to make sure that is possible. I'll kick it back to you, Kristy.
Yeah, awesome. So Katerina from the county is going to share some exciting updates on things we're looking forward to outside of the 100 fixed air quality monitors. So over to you, Katerina.
Yeah, first want to thank the JustAir team for your passion and building this powerful tool that can inform both our policymaking but also empower the community. And I want to invite everybody to sign up for the alerts. These are alerts that could be close to your home, to your work, to where your kids go to school. But I'm very excited to introduce the next phase of this project, because the stationary monitors was phase 1, and we are soon moving to phase 2. So the second phase of this project is going to be launched later this summer, and we are looking to distribute mobile air quality monitors to Wayne County residents to enable them to collect data on their own personalized air pollution exposures. We are hoping that this information will allow them to be better informed about the behavioral changes that they might need to implement, but also help their healthcare providers, especially for those asthmatic, to develop personalized action plans. If you're interested to learn more about the second phase of this project, but also stay up to date with the air quality monitoring project at Wayne County, please follow this QR code and sign up for our listserv. Now for our last session for the day, we have a Q&A session that Kristy will facilitate.
Awesome. Thanks, Katerina. So I guess it doesn't seem like our chat has too many questions, unless I'm missing any. But if you have questions, feel free to put in the chat now. Our team's emails are up here as well. If you'd prefer to email, reach out. We on the JustAir team are always happy to come to community meetings as well, and do an Air Quality 101 presentation. If that's something that you and your neighbors or family, friends would like to host. We do have a question here. One of the questions is, do these monitors pick up methane or any exposures from a landfill?
Yeah,
thank you for your question, David. Yeah, Darren, go ahead.
Yeah, no, thanks for the question, David. So currently, our stationary monitors are not measuring VOCs so methane is not being currently measured. However, something that we will be investigating is to enhance, some of the capabilities so the network can find those hotspots. So short answer is not right now. but that's something that we're definitely looking forward to add on. And the other thing, the context is as well is that really focus on the AQI elements, so the primary pollutants. But certainly, as VOCs are hazardous, there's certain methods that we will have to employ. So real sampling from sources of the pollutants. So happy to meet with you and talk a little bit deeper on that. But it's something we're definitely looking towards in this 3-year partnership. Thanks for the feedback.
And just to add on that, I think when it comes to methane emissions, one of the important things to understand is like chemistry in the atmosphere. So methane converts to particles, and it's part of what contributes to PM2.5 concentrations. So this is part of what the air monitors currently are measuring. So maybe not close to the source. We are not accounting for methane emissions, but longer distance a little bit. We are capturing it through PM2.5.
Yeah, absolutely. I think Katerina as well, and that's another thing as well that we understand that the like ozone, is catalyzing a lot of these gases as well. So, having more neighborhood-based ozone monitors, which we have throughout the network, will help us be able to pinpoint some of that. So, like Katerina said, we'll see some of the symptoms. But over time, as we investigate further and further, we'll be able to pick up the patterns and go deeper dive with our technology as we move forward. Good question.
Awesome. Thank you, David. If anyone also would prefer to verbalize a question, feel free to raise your hand and we can figure out how to get you off mute as well. So feel free to use that method as well. It looks like we do have, oh, there we go. Irma, I think you should be able to go ahead and come off mute.
Hello there.
Hey, Irma.
Hi, I have a question. I heard something that I don't know that I've heard before. And that is, are you able to identify the source of the emission, the source of the pollutant?
I can answer that, Irma. So as of right now, with where the technology stands, we can create a inference or a probability that we can predict it. So think of it like for particulate and things that we're measuring, think of it as like kind of cell towers.
Yes.
So using wind, using time, and using a pollutant, with the density that we have, we're in a better position than we ever were to be able to triangulate and look at those patterns based on the pollutants and how they move. So the short answer is that with a degree of confidence, we will prove over time as the technology improves, and that's our whole intentionality of JustAir, is really twofold. One, to identify the sources, and two, to be able to mitigate said source. But over time, we'll that's our whole goal, is really to figure out what the sources are through the technology. But that'll take some a couple months and some time with the data and to get familiar with it. So that's our intention.
Okay. Yeah, that's excellent. Thank you. Appreciate it.
Awesome. We have another question in the chat around getting access to data. David, I believe your question is specific to illness increases, so that might be a better question for the health department around data on rates of illness increase.
Yeah, so we do have trends of illness in our jurisdiction. We often rely on either the state or CDC to release that information, because unfortunately that's not something that we always have direct access to. We are happy to work with you to see what kind of information you're looking to have access to, and be able to share city by city. Typically the information comes at the census tract level, and then we can aggregate for the cities that you're interested.
Perfect. Thanks, Katerina. All right. Any other questions? All right, well, I guess we'll give it another second. Oh, we do have another question here. Sandra, go ahead and come on off mute.
Yes, I am inquiring about other types of, I guess you'd call them particulates. And I just want to thank JustAir and Kristy in particular, because I emailed her back and forth regarding air quality here in the city of Inkster, and she was very responsive. But mine was basically about the numerous marijuana facilities we have here in the city and how that impacts our air quality.
Thanks for joining, Sandra. It's great to hear your voice. I am not sure if Darren or Katerina would feel more comfortable following up on that one.
Yeah, certainly, we have to look at, the type of facility. Certainly, a lot of agriculture and transportation of any sorts of goods will be additive to, pollutants. It'll be particulate, in certain cases. So, without knowing the type of facilities, whether it's pure distribution or sales, situation, or actually growing, it'll be hard to say. But we could definitely understand, with the data, certainly the patterns over time. So one key thing that's, just a FYI for the community, I think I mentioned this, a really interesting thing is like hours of operation. So we get as granular to the minute by minute data, but the averages. So hey, around this time, around this area, every day Wednesday we see a spike. What's going on here, and we'll do further investigation to understand what's going on. So there's a long way to say is that yes, certain facilities, growing facilities or any agricultural facilities can produce exposure. Over time, I think, with more data and more resources, understanding what kind of pollutants that are emitted, we'll have a better handle on that. So hopefully to answer your question a bit, but yeah.
Well, just one more thing in line with that question. Is there are there any legal ramifications or any legal consequences for things of that nature if we find that we are being adversely impacted, both agriculturally as well as sales and production?
Yeah, I will speak to, I will let maybe kind of speak to it. I think what I wanted to add this theme is that I think one good opportunity with this information is to actually use this as a conversation starter, right? You're raising a home where, we hope everybody comes with the best heart, the best foot forward. So informing, residents say, hey, we see the spike, or hey, we have access to this data or information. Love to hear your thoughts on it and what best practices you guys have. Is a conversation starter, right? I think starting with, people who are doing business in our communities and making sure they're being additive and not extractive. I would recommend, as a resident, I'm speaking more from the resident side, but I'll kick it to, maybe the county, just to, maybe discuss or get some thoughts on, legal ramifications.
Darren, you're absolutely right. I think one of the main goals that I also mentioned for this project is that we want to identify those hotspots and then research and identify who are the contributors to pollution on those hotspots. Some polluters might be closer to the monitors, some polluters might be further away, but understanding where pollution is coming from is really key, and the network will help us identify that.
Thank you.
And also just to let you know as well is that we do have our Department of Environment, Eagle, who, now that we have this data and this history log and information and patterns, when we express an issue, we say, hey, this monitor spike, and that can just issue a response or a request to investigate further. So by having this data and the timestamps can also help, our environmental agency to really pinpoint, and they're the ones who, really regulate industry. And so this could be helpful as well for that.
Awesome. Thanks so much, Sandra.
Thank you.
All right, we'll give it another minute here for anyone to come off and ask any questions. Again, we have our emails listed on the screen here. We're always available to hop on a call to, or come do an air quality 101 session with any of your communities. We have partnered with a lot of leaders across the county as well. So we're happy to bring in, more local experts too. I'm also in the Detroit area, but we've worked with leaders across the whole county. So yeah, we'd be excited to come to your neck of the woods if we haven't already. All right. Darren, Katerina, Lukas, do you all have any closing thoughts you'd like to share?
Well, we have Irma, I think, with the hand raised. Maybe not.
Oh, nice.
There you go. Back up.
Thank you. So I just, I'm on the app. I just signed up. And so I'm going through the 151 results, but I don't want to see what's happening in Grand Rapids.
Mhm.
Is there a way to?
Yeah.
Okay.
Yeah, absolutely.
So-
Yeah, so we could maybe go back a slide, Kristy, and also
Yeah.
to the right here. So it probably doesn't show this correctly, but there should be, if you don't see it, I'm happy to follow up with you, but there should be a by my location, and it will if you turn your location settings on, like near me and near me, and also that drop down, you can click Detroit and it will zoom in to wherever you're around, and you can start selecting monitors around that. Also, once you selected them, there's a sidebar to the left. And we'll come up, we'll have better FAQs and response, but the sidebar will say my monitors on the side, and you click that and you will only see the one you subscribe with, so you can block out the noise of all the monitors in the network, only focus on ones that you hearted, right?
Got it.
But great question. We're working to make it more attentive. Did you get to it?
Yeah.
Oh, that's
It's
cool.
working.
Glad it worked. Yay. It worked. Give me a heart attack. No.
Everyone, this could be you. You could be Irma subscribing to monitors now. Irma, thanks for asking. Great question.
All right, you're welcome.
And if Irma, you or anyone has feedback on kind of your experience on the JustAir dashboard, you can send that feedback also to the info@justair.co. We're always excited to hear what people are thinking as they use the tool. Katerina, Lukas, any closing thoughts from you two?
I think on our Wayne County side, we are really excited for this partnership and this project. The network is really going to empower us with the information that we are collecting for policy decisions. I want to thank everybody for attending today. So anything else that Lukas or Darren want to add?
No, I would say thank you so much. I know you residents were taking time out of your day to work on things that is happening to us, and it's not lost to us and just their team. Everything that we're building is for us. So please push us. Please ask those hard questions. If things are not easy for you, we're responsible. At the end of the day, like, this service is for us. So just thank you for taking the time out of your day, and thank you for fighting for the work and making sure we keep our communities and families safe. So appreciate it. And thank you to the county for helping us organize this.
Sign up with the monitors, sign up for the project to stay tuned. As a reminder, this session is recorded and we'll be sharing both the slides and the recording, so please stay tuned.